So does the body move during brain and spine surgery? So there are two types of spine surgery and brain surgery. You can do awake brain surgery where you actually wake the patient up. A lot of times you do that in tumors that are in eloquent areas, meaning areas of the brain where you are very cautious about hurting because it could cause permanent deficits. For example, a tumor that's in the speech area, you may want to wake a patient up in order to see how they're speaking while you're taking the tumor out to see if it has that effect. So in those cases, obviously, you do want to wake a patient up. That dramatically influences your anesthesia plan because you got to wake the patient up. That when you do wake a patient up, particularly when you're working on the cerebral cortex, there's a higher rate of seizures. So a lot of times you have a bucket of ice water there because if the patient starts seizing, you put the ice water, which is very effective in controlling seizures. The other part is if the patient wakes up unintentionally during surgery, and that does happen sometimes with spine surgery. Sometimes we do neuromonitoring, so a patient gets light during surgery and they may start moving. Usually these cases, they're not awake and talking to you, but they are moving, and when you're working around nerves, is a concern because you don't want to be doing a critical part of the operation where you run the risk of causing a nerve injury. So in those cases, usually what you do is you stop, you notify anesthesia, you notify monitoring, you make sure the patient is asleep, and then you proceed at that point. So the answer is yes, patients do wake up. Sometimes it's intentional, sometimes it's unintentional, and it's handled differently.